Okay, so today we're gonna do an injection for Gina to simulate what it would be like to have the depressor anguli oris muscle removed. And the way we do that is by injecting a little bit of lidocaine into that muscle and letting it sit. It will work pretty quickly, so you'll feel just the pinch of the needle and then a burn for just a moment as it the medicine goes in, and then we'll see what we get. So just rest your head back here. This down. So this DAO muscle is that long name depressor anguli oris. That muscle is the frown muscle, and so we kind of go in here right between the corner of the mouth and the jawline, and inject about 1 milliliter of lidocaine. And this does have an acidity to it, so there's a little bit of a burning sensation, but it'll kick in pretty quickly. You. We've tried the Botox into that muscle, and unfortunately, because of the nature of Botox, it diffuses into the other muscles, and it has actually caused a little bit of trouble for you getting your lip to pull down, because it probably diffused into the muscle next door called the DLI muscle. So that makes the Botox less of a good idea for that area for you, and everyone's a little bit different. But the next thing we're gonna do is the Botox, the other areas that have had success in the past, and Dr. Leonard's gonna help me remember exactly what the doses are that we've figured out for you. So Dr. Leonard, go ahead.
We're gonna start on the left with 2.5 units to the left lateral orbicularis oculi.
Okay, great. So just right there at the orbital rim, and 2.5 units, okay.
3.75 to the left inferior oculi, 1.25 medial, 2.5 lateral.
Great. And these muscles are problematic in patients who have incomplete recovery of facial palsy because they neither strengthen all the way nor relax all the way. So the Botox helps relax them without over weakening them, since they're already a little bit weaker than your other side.
2.5 to the left mentalis.
Okay. Smile for me so I can see that mentalis. Okay, that's good. And this is the chin dimpling muscle. Okay.
We're going to switch to the right side.
Yep. And then turn your head this way for me. Great. Okay.
6.25 units to the right forehead.
Okay.
1.25 medial, 2.5 central. 1.25 superior central.
Lift your head bone all the way up for me. Good. Relax. Good. Okay.
1.25 lateral.
And so on this unaffected side, we do the Botox to try to balance things out and kind of calm down the areas that are excessively functioning relative to the left side.
1.25 to the right ZM.
Okay. Smile really big. The ZM is the zygomaticus major. Go ahead and relax. That's the primary muscle of smile. That's the one that kind of pulls your lip up and out. Go ahead.
1.25 to the right LLS.
This is the levator labii superioris muscle. This is the one that kind of pulls your lip up when you're smiling, more toward the midline. Okay.
2.5 to the right mentalis.
All right. And we'll just even out the chin here with a little injection into the mentalis. Okay.
And then the left platysma.
We'll go back to the left side. This is the tense area here. Go ahead, Jamie.
20 units. It'll be 5 units medial superior, 5 medial inferior.
All right, give me a big smile so I can see that tension. So I see the bands of muscle kind of protruding there. Okay, relax. And turn you to the middle and lift your eyes all the way. I mean, lift your eyebrows up front. There you go. And that's where I'll see the bands engage again. Okay. And that's it. Cool. How was it?
That was easy.
Okay, good. Now we get to assess the effects of the lidocaine on your smile, which is kind of cool. So you hold this for me, and then give me a big smile. What do you think? Do you think this is turning up maybe what it was? So you see this, there's a little bit of fullness here. That's just from the fluid from the lidocaine, but I do think it does something. But yet you don't feel like it's giving you trouble pulling this out. So this would be a little better option for you than the Botox to that area. So
yeah, it definitely makes it more symmetrical.
Yeah.
Yeah.
So that's something now we get to talk about what that surgery would be.
Okay.
All right.